Sidhu Moosewala mother.
Yes.
That case was very much highlighted. Isn't there any age limit to go for IVF?
Freeze your eggs.
Like freezing, no. Some people believe that if you go through IVF, they have a boy child.
More with the mouse than with your spouse. How many times a week? It's a week, doctor sir. In a month we get a time. कहावत है कि आदमी और घोड़ा बूढ़े नहीं होते हैं.
What's considered a healthy sperm count?
It's not only a woman who's responsible for producing a child. It is a man also.
Hello and welcome to our show प्रॉब्लम क्या है. तो आज हम बात करेंगे एक ऐसी प्रॉब्लम के बारे में और आइल्स से एक ऐसे सोल्यूशन के बारे में which has made dream of becoming parents possible for those who are not able to do it naturally because of some complications. Yes, I am talking about IVF. ये टर्म तो बहुत सुना होगा आपने अपने आसपास, सोशल मीडिया पे या फिर गुड न्यूज़ पिक्चर में तो ज़रूर सुना होगा. But still many people hesitate to talk about it because of getting judged, or maybe because there are a lot of myths around IVF in our society because of lack of awareness and lack of right knowledge. So to know what is IVF and to debunk some myths around it, we have an expert with us today, Dr. Jyoti Bali. Welcome to our show, Doctor.
Thank you so much.
So we begin with the basic thing. What is IVF?
IVF is a scientific treatment where eggs and sperms from the man are taken outside the body. Naturally, what happens is the sperm and egg fertilize in the fallopian tube of the woman. But for some reasons, if they are not able to, then we decide to take out the eggs from a woman's ovary and ask the man to give a semen sample, select sperms from that, and fertilize the egg and sperm in the laboratory, in the IVF lab. And what is resultant out of the two after the fertilization is an embryo. And then these embryos are transferred back to the uterus of the woman. So this is in a nutshell IVF. What you call it is test tube baby. It's not the baby which is formed in the test tube, but the fertilization which happens in the test tube, we do it out in a test tube, and which is naturally happening in the fallopian tube.
So doctor, like you said, it's a test tube baby. So there are a lot of myths around it. So why you think that, even in today's time, people are so much hesitant about IVF?
It's a social taboo, I think, in the families, in the society. People are made to feel that it's a stigma. A woman is always questioned about it, that, why she's not able to produce a baby. So it is very clear that, it's not only a woman who's responsible for producing a child. It is a man also. And the incidence of male infertility is on a rise. And trust me, it is 50% as of today. 50% cases will have factors which are from male and 50% from a woman. So it is equal.
Doctor, what are the factors that this infertility concerns are there? Whether it's women, and now you said that men are also in that line. So why are these increasing?
Lifestyle is a factor, major factor. Increasing age where women are concerned, because every woman is wanting to delay her marriage because of her career. They're all wanting to be financially independent before they embark on a journey like that. They want to have that freedom. And then by the time, for every woman, the biological clock is ticking. So we have to understand that while balancing everything, a career and the biological clock of the ovary, we can balance both and have the best of the both worlds. For every girl, I would say that if you're not able to find Mr. Right, there is no need to hurry or get pressurized. If you haven't found your Mr. Right, don't worry. Relax. Don't get into the pressure of the family or your peer pressure or friends or society or any reason. Just freeze your eggs. Let's say you're 31 today and you're not able to, take a decision regarding getting married, or for whatever reasons you wish to delay. It's your choice. After all, it's your life. Why should somebody else dictate terms to you? So go ahead, freeze your eggs. Maybe 3 years later, you will say, now I got married, I'm happy, I'm sure I want to have children with this man. Fine, I want to start a family. The eggs which you had frozen will be at 31 years of age itself. Whereas when you come at 34, if you were to start, you will take 1 year of trying in a marriage. Come at 35, by then maybe most of you will, have a lower ovarian reserve. The quantity goes down with age every year. And then in some cases, even quality goes down. So why put yourself at risk? I always say, You take an LIC, you take SIP, you do what you want to do with your insurances. We take so many precautions. So this is an important factor of your life. So why not go ahead and use this technology of oocyte freezing, the egg freezing?
Yeah, because people are not aware of it, so they don't support egg freezing.
Yes.
They're like, egg freezing, no, no, no.
Why not?
People have that.
You will buy gold and keep it for your daughter's wedding, every family. So why can't you secure your daughter by doing oocyte freezing? And everybody has their own time in life to, get things. Sometimes things can be delayed. You have to find the right man to get married. You may be wanting to finish your studies, higher studies. Maybe you have some plans at your job profile. You may be getting some opportunity and you are not able to do it because you have to plan a family. But if you can freeze your eggs and then plan, so you will have best of both the worlds without compromising on anything. So why not?
So like you said, that lifestyle is a factor in
Yes.
fertility issues. So stress.
Stress is one of the factors, but the stress comes from the hustle-bustle culture that we are living in. Corporate culture, working women, and they have to manage house chores and then manage their work front. And the responsibility of a woman is, of course, much more than a man. So she is the person who's burdened. Then for men, I would say they are also, the corporate jobs are keeping them very busy. Lifestyle, the eating habits are not right. And fast food, not getting good nutritious food, not eating timely, not sleeping on time. Then to make matters worse, then I think we have our radiations coming from mobile, laptops, more with the mouse than with your spouse. So that also is a problem. Then I think there are added factors in a metropolitan city. Of course, you see the kind of lifestyle that we are all living now. So where is the time? Most of them sometimes, they come to the clinic thinking that IVF is some magic wand. They haven't, when you go into their sexual history, there is no time. Both are coming back tired from a corporate job. And I see, and you ask them how many times a week? It's a week. Doctor, in a month we get a time. So then how do you expect conception, natural conception to happen? And they feel IVF is a press button technique, that you press the button and IVF is a technology which will sure shot give them a child. It's not so.
And some people believe that if you go through IVF, they'll have a boy child.
Yes, that's a very good question that you asked me, Roshni. I must address this question through your podcast today. Please understand that IVF is not a technology where, we can choose the sex of the baby. And here in India, we have to follow our country's law. Let's respect the law of the land. We do not do sex selection at all because the government does not allow us. And it's a crime, it's an offense. So the sex selection people have two girls and they come to us that they've come for IVF because they want a boy child. It's not possible. Please be happy with whatever God has decided for us. There is no need to ask for this question in any of the IVF clinics in India. It's a crime it's been declared by the PCPNDT office, the government of India, that this is to be decided by God Almighty.
Yeah, that's true.
IVF is not an indication for sex selection or a boy child. And please understand, it's not the female who decides that, whether ladki hogi ya ladka hoga. ये decide होता है Y chromosome से, which is a man's chromosome. So the factor is always dependent on the male chromosome, which will decide whether you'll have a girl or a boy. So stop blaming a woman every time for it, that she's produced only girls. So she's not responsible for it, please.
जैसा आपने बताया, तो हमने सबने गुड न्यूज़ पिक्चर देखी है एंड आई थिंक उसी के बाद ही IVF वाज लाइक लाइक हाइक्ड अप सो वी सॉ दैट स्पर्म चेंज इट वाज अ जोक देयर बट इन रियलिटी इफ आई आस्क यू दैट यू आर IVF स्पेशलिस्ट सो ऐसा होता है इज इट पॉसिबल?
I'm not saying it can't happen. It's a rare possibility, but every clinic is very, very, very careful. They like to code, label the bottle. There are multiple checks. So I don't think it's a routine thing that will happen in any clinic. So be assured about it.
Have you ever heard any case around you? कभी ऐसा आपने सुना है?
No, not really. Movies, I think it's been exaggerated. Every clinic takes precautions, and even if there are, names same, there is a way of labeling everything in the clinic, in the lab. There are multiple checks for this. So I don't think that this is a routine thing that one should ask for it. I don't
It's
think
fine, safe.
Movies में होता है.
Okay. So also an example of, Siddhu Moosewala mother.
Yes.
That case was very much highlighted. So I need to ask you, isn't there any, age limit to go for IVF?
As per the ART law, 50 years for a woman is the upper limit of the age. Where this case is concerned, I've already released a video from my clinic on YouTube. This was a case which was different, and I think the government gave them, the Punjab government probably had given them the permission. But I would say that, see, whatever the emotions of the parents who lost a young son and that too brutally murdered, well, keeping that in mind, there's another side to it. If you're producing children beyond the age of 50, the government is absolutely justified in bringing this law that more than 50 years of age, people should not be allowed to do IVF and produce child. Because that is done by third party, that's called as third party reproduction, where you take donor eggs, because this woman will only be using her uterus. If the child, you are 55, 60s, let's say, what will be your age when the child is 20 years, 75 years? Something happens to you, your child is left without being settled. So is it right to produce child through this technology and not giving him a safe future, not giving him a secure parental care? Is it right on our part to do that?
No.
So there lies the answer. The law has been very well thought of, very well decided. I think it is the moral duty of the doctors and the IVF specialists to say no.
So how this was possible through donors' eggs?
Yes.
If you say.
Yes.
Okay. And also there's this thing, like, I read online also that a man never gets old. He's like an horse.
Yeah, that's another very good question, Roshni, you brought up.
I mean, what does that mean?
कहावत है कि आदमी और घोड़ा बूढ़े नहीं होते हैं. बट जहाँ तक इनफर्टिलिटी का सवाल है, स्पर्म क्वालिटी, स्पर्म काउंट डाउन हो जाता है एक एज के बाद. औरतों में जल्दी होता है. Women face aging earlier than men, but men also have, after 40, sperm DNA fragmentation rises, count decreases, but it is slower in males. But certainly, the sperm count is not the same in an old man than compared to a young man. And then the DNA of the sperm also starts getting fragmented. So there are problems with age of a man also, but not so much as a woman.
So what are the factors, that affect sperm count? Many young boys also facing this problem.
Alcohol consumption, smoking more than alcohol consumption, and then the supplements that these young boys have started taking in the gym, steroids, testosterone, supplements, all these supplements containing these hormones. So I think that is something which one should avoid, because muscle mass is being made, no doubt. They think they're looking very, very massy, and they're looking very classy at the same time. It's a kind of a fashion statement amongst the peer group. But please understand, when it comes to semen analysis, and when you look at their semen count and you take the history retrospectively from them, that were you going to a gym, were you using supplements, they very proudly say, yes, ma'am. And then you get the answer why the sperm count has been like this, why it has gone low like this. So that is one thing these young boys should remember. You go to a gym, it is good to exercise. It's good to take the protein diet at home. But do not use any gym supplements, my humble request.
There are a lot of people, who are going through the IVF process, and they say that IVF is expensive, and because of this, many people, who are middle class, they're not able to afford it. So what is how affordable is IVF? Is it really expensive?
IVF cycle, yes, it is expensive, because see, there are a number of people involved. You need basic minimum staff, about 7 to 8 people. You need a neurologist, you need a doctor, you need an assistant doctor, you need a counselor in the clinic as a requirement. Then you need a lot of licensing work to be done for this. And after all, the procedure, the lab has to be maintained through an air handling unit. Equipment is imported, expensive equipment, and maintenance is required. So certainly, if there's a technology being used, there will be a cost to it. We fixed the cost of the lab procedure, that is 60,000 rupees. Now, anybody from any strata of society, whether you come in an auto or a Mercedes, the person has to pay the same amount. 15,000 for ICSI if required, that comes to 75. Now, rest of the cost comes for the drugs, the injections that a woman has to take, hormonal injections for 10 to 12 days. Now, that is coming from the pharma company. The cost is written on that injection. Either you buy from a chemist or you buy from the IVF center. The cost is the same. Maximum, we can give you 10% discount on that. After that, the package starts from 1,30,000 total, including these injections, and it goes up to 2 lakhs depending on your age, weight, and your results of the test, which we've done, like AMH. We calculate the dose and we give you an approximate idea. So, rough around package is 1,30,000 minimum, and maximum it goes to 2 lakhs. Now, how does that differ? We tell the patient that, look, emotionally, a person who can afford is also, needs a child, and a person who's driving a rickshaw or auto rickshaw also needs a child. So as a doctor, my duty to look after both the patients equally, passionately, equally, with no difference. Justice has to prevail there. So what we do is we tell them there are two kinds of injections. One is the intramuscular ones, which you have to go every day to a nurse and take it near your house, or if you're near the center, we will give it to you without any extra charges. One is recombinant injections, which are like, how elderlies take insulin, that small syringe, that is recombinant injection, which one can administer subcutaneously below the skin. So you can do it for yourself on daily basis, but they are expensive. The cost will come for that technology. So we offer and we tell them that, look, from our side, no difference in the results. So you choose whichever one. So overall, it makes a difference of 25 to 30,000 by the end of 10 to 12 days of stimulation. Beyond that, then we give them offers like you pay within 3 months. The clinic doesn't charge any interest on that. If somebody still cannot afford, we tell them go ahead and take a loan. We have some tie-ups with some companies, provided their civil score is right. If that is found correct, supposedly let us say the average cost of IVF was between 130 and 2 lakhs. I said, let's say 150 was the package. We tell them take a loan of, give 50,000, take a loan of 1 lakh, you divide it in 10 months, it comes to 10,000 per month, or you divide it in 12 months, it will come to 8,900 something. So that is affordable. So these are the methods that we tell a patient to, how to cover this cost and how to make it affordable.
Doctor, there's this term, designer babies, a lot of the market.
Oh, yes.
People think that, is there any technology, like people think that through IVF, we're going to have a child, he's going to have grey eyes, golden hair. Is there any technology like that?
No, we don't use it in routine. There's nothing like that we make designer babies. It's your eggs, your husband's sperm. So it is your genetics which is going to be there.
What are the precautions you suggest before going through this procedure, during the procedure? What are the precautions?
First of all, stress-free life. Try to, calm down, bring down your stress levels. Ideal body weight is important. If you're planning to have a child, kindly lose some weight if you're on the obese side. If you're lean, then have nutritious diet. Visit a clinic. Do not ask your doctor to start the IVF cycle just on the day 2 when you arrive in the clinic. Give that doctor a month's time or 1 cycle at least to evaluate both the husband and the wife and bring down on paper all investigations, check if everything is normal. Thyroid levels is important, prolactin is important, your thalassemia status is important, rubella vaccine immunization to check, it's important. So let the doctor go through all your investigations, give you pre-ART medications like folic acid, vitamin B12 if you are a vegetarian, vitamin D3 levels need to be checked, thyroid levels to be corrected if at all. Thyroid levels are for a infertility treatment, I would say the level should be 2.5. If it is 5 is in the normal range from most of the labs, but for infertility treatment, it should be brought down to 2.5. So in case the doctor wants to start thyroid medicine, take that for 4 weeks. Sugar levels are important. If you're diabetic, you're hypertensive, all that needs to be corrected and brought to a baseline, and your doctor should know about it, and then embark on the IVF cycle. By then, you will get friendly with the clinic, the staff, you'll be familiar with everything. You will know your schedule, you will know the chart as to how many leaves you need to take, how much time you need to spend in the clinic. All that is discussed.
Look at the other side, the complications
of IVF. IVF done in safe hands, by and large, is a very established procedure. And 0.1% now, even I don't see those kind of complications. Procedure is very, very safe.
There were few cases, you read online the news, complications are there. So is it through the IVF or just before the process people have?
I mean, earlier, IVF complications, what complications have you heard of, Roshni? Tell me this first.
Some people say that through IVF you get cancer.
No, these are myths. I would not term it even as a complication, these are myths. So I don't think IVF causes cancer. IVF has been established in the market for how many years? It started in 1978. The world's first IVF baby was born in 1978, Louis Brown in UK. And India was the second country in the world. 67 days behind them, we had our first IVF child, 3rd October, Kanupriya Agarwal from Calcutta. So Dr. Mukhopadhyay was the first IVF specialist from India. So we were not far behind in technology. It's a proud thing to say that, we Indians were just second on the world map. So it's been established for so many years. So it's a safe procedure. In good hands, it's a safe procedure.
And how true is that through IVF, if you're going through IVF, so the genital disorders, the child, that there can be more chances of...
The chances of abnormalities through an IVF baby or a baby born through natural conception, let us say. All the research work done in so many years now, 39, 40 years, it's that 2% risk of a genetic abnormality or an abnormal child born through a natural pregnancy vis-a-vis an IVF pregnancy. It's the same risk.
So doctor, what kind of, we talk about the complications and precautions, what kind of diet you suggest to the mother before going through the process and during the process?
Come for a checkup before you, it's called pre-ART counseling. You can come for a checkup, look at all your regular tests. Diet should be good protein diet, homemade food, your weight should be ideal, your BMI should be ideal. And if at all, even if you lose 5% of, if maybe you're obese, 5% of your body weight, it helps a lot in these treatments.
Anything specific that should be included in the diet?
All fertility foods you can take off. You include all good fruits, green vegetables, vitamin C, vitamin D, vitamin B12. Take all the diet which is rich in this. Vitamin C, the maximum content is in amla. If you can't take amla, take 1 lime every day. Orange, but orange has good sugar content also. So choose lime, which is the easiest one. If you can get amla, nothing like it. And then vitamin D3. Sunlight is the best source, but we will use our glares. We will sit in the office, which is AC office, car, which is AC, rooms, which are bedrooms, which are AC. So where do we have the time to go and expose ourselves in sunlight?
Plus tanning.
Plus tanning, we don't want tanning at all. So all these supplements can be started. Folic acid, of course, can be started 3 months prior to your planning your pregnancy. And good, rich, nutritious diet made at home.
And what about the hygiene? Anything that has to be done? The couple has to, any kind of certain hygiene practices?
Yes. For a woman, I would say we always do a per speculum examination and we always give them antibiotics or any pessaries to be kept in the vagina. For a male, if semen analysis or any infection is found, semen culture can be done and antibiotic can be given. One more thing I wanted to point out was that women like to use a lot of these intimate washes in their, but yes, it should not be used regularly. Why? Because your vagina has an acidic pH. If you continuously use it, it will...
So is it during this, around IVF or normally also? Generally also?
Yeah, it should not be used on regular basis unless advised.
What are the side effects?
Because see, your vagina has a certain pH, so it doesn't allow the organisms to go through or pass through that acidic pH. But if that acidic pH is not maintained because of these washes, then more chances of getting infected.
Now I have a short and quick rapid fire for you.
Sure.
Okay, you just have to say that is whether it's myth or a fact, or you can say maybe also. So doctor, what's considered a healthy sperm count?
15 million per ml. As per WHO guidelines.
IVF causes early menopause?
No, it's an absolute myth.
IVF is only for women?
Not at all. As I said, the incidence of infertility is equal. 50% cases are of male infertility these days, and the first test that should be done is semen analysis. Whenever desiring to have a child, come forward, ask for semen analysis. We do it free at our clinic.
IVF leads to cancer?
Not at all. IVF does not lead to cancer. It's a myth.
IVF clinics all are the same?
Most of the clinics have established a standardized procedure, but do check out for the experience of the doctor and the clinic's results and air handling unit in the IVF lab and availability of the embryologist 24 hours.
IVF babies are unhealthy?
Not at all. IVF babies are equally healthy as natural conception babies, and the risk of abnormalities also is 2% in both the conceptions, IVF or natural conception, and they are equally cute, adorable babies.
IVF is always successful.
IVF, unfortunately, is not always successful. The result is 50 to 60% per embryo transfer.
Okay, doctor, before we end our show, any advice you'd like to give to our audience, who want to go through this IVF process or already in this IVF process?
To all the people who are desirous of a child, girls and boys, tomorrow you will be men and women. Please freeze your semen and your eggs and then have fun. Come back when you are really ready to have a child. But at least plan today, and tomorrow will be yours.
Any like five precautions you want to give to the couples who are
going through IVF? Remain stress-free. Have patience. Have faith. One day you will have a baby, whichever how. Have faith in the clinic. One IVF failure should not deter you. Second IVF, discuss again. It may take time, but your doctor will be able to give you an answer why this IVF failed. And if the doctor says, keep patience, please keep patience, you will have a baby, because sometimes it's about repetition of the cycle. One cycle is not enough. You may need a second cycle, so go ahead with all your energy, be positive and never give up.
Is there's a limit of the cycles?
Yes. I would say 3 IVF cycles or 10 good embryos transferred, you should call it a day, and your doctor should also agree to this and call it a day and discuss what next. Next options will be suggested to you, like donor egg, donor sperm, or maybe the uterus was the reason why you could not conceive because of the lining of the uterus. Then maybe we talk about surrogacy. There are only 3 factors in an IVF. One is the egg quality, sperm quality, and third is the lining of the uterus. So it is seeds and the soil. Seeds are your egg and sperm, soil is your lining of your uterus. So either of the 3 factors will be pointed out in those 3 cycles records, and once the records are analyzed, if the egg is the culprit, well, the advice given will be donor egg. If it is the sperm quality or the problem there, then of course sperm has to be replaced. Take a donor sperm. If it is the uterus, then of course surrogacy is the answer.
Yeah, surrogacy is also trending nowadays.
Yes.
Right. So it's like, do you suggest?
Surrogacy is a treatment option which is only now with ART law 2021. We have a law in our country. So that with looking at that, only those couples who've never had a child and never natural conception or never a child through surrogacy before, only they are eligible. There are criteria to that now. So if there's a valid indication, the clinic has to write the indication, why have I suggested surrogacy in this case? Whether she's a case of 2 multiple failed IVF, 3 IVF failed, or maybe there was a lining is an issue. All that documentation is very important. So if you have all those records, you can apply for surrogacy. A lawyer will guide you further with this. The ART board will give you permission for this, and then we can take a surrogate and transfer the embryos in a surrogate. It's a legal process now. Legal as well as through the ART board.
Right, doctor. Thank you so much for being here today. And I hope that you have got all your answers. Well, that's all for today. Keep watching our show, Problem Kya Hai. I'll see you next Sunday.